It's important to warm up your knee joint before initiating any exercise, including GoKnee's protocol. Even more importantly, we want your brain to trust GoKnee, and that is what the purpose of this warm-up will be. We want your brain and your hurt knee to become familiar with the device. The more certain your brain is that the device and you are not going to hurt your knee, then the more motion your brain will allow, meaning you will be less likely to resist the movement or tighten up your muscles trying to protect your knee because you think it's going to hurt. The key motion you will be doing during the warm-up is this motion. You want to push the handles away from you while pulling your ankle towards you. This will result in your foot coming off the floor, and that is exactly what you want. Then you'll pull the handles back towards you as you slightly kick your foot forward into the bottom pad. Don't worry, even if you do push unevenly, you're not going to hurt your knee because the device will simply come apart like this. This is a safety feature built into the design for your own safety. If this happens, then simply pop the device back together, just like this, and continue. Now, it is completely normal to feel pressure, considering your knee is likely stiff and tight and swollen if you've had surgery recently. But try to apply steady pressure with both your hands, with the top pad pushing behind your knee in a forward direction. You're not going to hurt your knee, whether you've had knee replacement surgery recently or you have arthritis, it is safe. So push as much as you can tolerate. If you can put enough pressure, the top pad can actually cause a mobilization at your knee joint. And a joint mobilization is a technique that we therapists use in the clinic to improve flexibility in a joint, to release tension, and to relieve pain. The GoKnee allows you to safely do this on your own, while you're in control and in your own home. Let's get back to kicking your ankle forward as hard as you can for 20 seconds. Remember to hold the device handles firmly. You want to keep it steady. In essence, what you are doing right now is strengthening the muscles on the top of your thigh, called your quadriceps. I know it doesn't feel great, but it is crucial to your knee recovery because it provides stability to your knee. Now immediately, try to pull your ankle backwards away from the bottom foam pad. What you are doing right now is actively trying to bend your knee as far back as possible. This helps to gain the motion that is necessary for normal daily activities, like going up and down steps, getting up from a low chair, and getting dressed. You are doing great, and we are more than halfway done. Now that your leg is in the right position, we're going to begin a steady stretch to improve your knee straightening. So go ahead and gently apply a downward pressure with your hands on the handles of the device to further straighten your knee. We will start our 2-minute timer now. Simply having your leg in the device in this position can cause a significant stretch or pulling sensation behind your knee and sometimes all the way down your calf. Even the weight of your hands on the handles causes enough pressure to stretch the knee and can cause discomfort. Push your ankle down into the bottom pad as hard as you can. Remember, you are trying to bend your knee and bring your foot back down to the floor, but the device is not letting you. Push hard. I know it's difficult and you are getting tired, but you are more than halfway done. Go ahead and try to lift your ankle up off that bottom pad. If you have ever done a plank or a wall sit, then you know that your muscles can work hard with little visible movement. So simply trying to lift your ankle up from the foam pad will work the tissues surrounding the knee joint. This exercise helps to regain the last few degrees of knee straightening. This exercise is so important. The purpose is to increase control of your knee at its end available range. Kick your ankle up into the air as far as you can and remember to not let your knee lift off of the foam surface. You will hold this for 5 seconds. We will now rest for 10 seconds. Focus on moving your leg slowly with control when you lift it up and when you lower it down each time. Kick your leg up as high as you can and hold. I'm actually pushing my knee down into the top pad while I try to lift my foot up in the air.